A ZIYO, fountain of knowledge. Cardiovascular disease, heart attack, stroke, etc. Disclaimer. The information provided in this video is intended for general information purposes only. Information concerning any product is not intended to provide or substitute medical advice. This video is in no way intended to offer medical diagnosis or patient-specific treatment advice. You should promptly see a medical doctor or healthcare provider if you have a medical condition. Having a heart attack or stroke can be scary, leaving you wondering why it happened and what you can do to prevent it from happening again. The good news is that you could cut the risk of another cardiovascular disease, CVD, event by making some lifestyle changes, such as lowering your cholesterol and working with your healthcare provider, e.g. doctor, nurse or local pharmacist, to ensure you are on the most appropriate management plan for you. Though it is indeed possible to not only survive but also recover from a heart attack or stroke, it is crucial that you are aware of the risk factors and are working towards reducing your chances of another CVD event. It might have been difficult to monitor and manage your cholesterol over the past few years, especially due to the COVID-19 pandemic, but you no longer have to hold back from discussing what's the right care for you with your healthcare provider. What is cardiovascular disease? Cardiovascular disease, CVD, is a general term for a family of conditions with common risk factors that affect the heart or blood vessels. It is usually a result of the buildup of fatty material inside the arteries, also known as atherosclerosis. The different types of CVD include coronary heart disease, CHD, stroke, peripheral arterial disease. Coronary heart disease, CHD. CHD is the most common type and occurs when arteries lead to the heart muscle becoming narrowed due to fatty buildup. 7.9 The blood can't flow around the body and back to the heart easily, causing blood clots to form. Stroke. A stroke occurs when an artery in, or leading to, the brain becomes blocked, cutting off blood supply. A transient ischemic attack, TIA, mini-stroke, is caused by a temporary disruption in the blood supply to part of the brain. People with CHD, or those who have had a heart attack, are twice as likely to have a stroke. Peripheral arterial disease. Peripheral arterial disease is a condition where a buildup of fat in the arteries limits blood supply to the limbs, usually the legs. Disclaimer. The information provided in this video is intended for general information purposes only. Information concerning any product is not intended to provide or substitute medical advice. This video is in no way intended to offer medical diagnosis or patient-specific treatment advice. You should promptly see a medical doctor or healthcare provider if you have a medical condition. Please subscribe to this channel to get more knowledge, information.